The federal government announced today the details of the new dental care plan. It's a $13 billion program expected to help up to 9 million Canadians whose net income is below $90,000 and don't have dental insurance.
The Canadian Dental Care Plan will cover a wide range of services for Canadians. It will cover preventative, diagnostic, restorative, surgical, among other services to ensure their smile is healthy and joyful. These include x-rays, fillings, root canal treatments, and dentures.
Now, the dental care plan was, of course, a main condition in the NDP supplying confidence deal with the Liberals, and NDP health critic Don Davies joins me now. Mr. Davies, thanks for coming in.
Great to be with you, David.
You took a lot of heat saying that you're going to prop up this government for a dental program they would never deliver, but here it is. How does it feel that that's gotten to this point?
Well, it feels fantastic. I don't think it's an exaggeration to say this is a historic day. I think you're right. A lot of people didn't think this could happen. Civil servants told us that our timeline was too ambitious. There were constitutional issues. They said provinces wouldn't agree. But we persevered, and we worked really hard on the NDP side. And we knew this was a flagship component of the Confidence and Supply Agreement, and we knew we had to deliver a good program for Canadians. So I think we did that here today, and I feel really satisfied.
It still needs to be phased in. Eligibility is going to roll out on a staggered approach so to make sure it goes smoothly. But there is still some opposition provincially. We've heard complaints from Quebec about this intruding into jurisdiction. How much do you worry about that and the possibility that maybe some provincial dental programs may recede and dump the costs onto the federal government?
Well, it's a concern, but I'm not terribly concerned at this point. First of all, this is a national program that's 100% paid by the federal government. So I don't see that being an incursion into provincial jurisdiction. Second, with Quebec, as is always the case, if Quebec wants to opt out and construct their own program that's equivalent with compensation, that certainly can be negotiated. But, if I were a premier or a territorial leader and I had the federal government that was prepared to pay 100% of the costs of residents in my province or territory, in order to get them to have their oral health care needs taken care of, I would leap at that. And the other thing is that keeps people out of the emergency rooms. Mm-hmm. So it's a cost savings to the provinces. So I think it's a win-win for the feds and the provinces and territories.
So if the provinces do pull back what existing dental because there's kind of a patchwork across the country. It exists in some provinces, not in others. You'd be okay with that if a province said, well, the feds are now filling the space, we're going to pull back and put 100% on Ottawa?
Well, it's not our intention. Our intention is for people who already have coverage to continue that coverage, and we want to make sure that everybody who doesn't is brought up to that level. Right. That's our intention. And I understand the federal government is in talks with all of the provinces and territories, and my information is that that's going well. I don't think any province or territories are looking to diminish the coverage that they already have. And by the way, there's no province in the country that has an excellent program.
No.
There are people in every province, seniors, kids, low-income people, who don't have access to this vital primary healthcare service. We're talking about 33% of Canadians. That's 13 million Canadians don't have dental care. So this is a major step forward.
Yes, if the numbers of 9 million qualifying for this, that speaks to the need and clearly the gaps that exist in the system. But this is a fill-the-gap system. It's not a universal benefit. Mm-hmm. You're also in negotiations with them on pharmacare. Why is fill the gaps good enough for teeth, but not good enough for drugs?
Well, the NDP has as a bedrock principle that we believe that all healthcare coverage, head to toe, should be delivered through our public healthcare system universally and comprehensively. So I guess the reason that we moved this way in dental care was on pharmacare, there's been decades of work, costing, academic research of the way that we can fold pharmaceuticals into our public healthcare system. So that's why that's been our red line on pharmacare. On dental care, we don't have that kind of work yet. So we campaigned in the last election on covering people who don't have coverage now as a first step, as a down payment, if you will, towards universal dental care. So we acknowledge that this is a major step forward, but there's more work to do, and we won't stop until everybody has dental care provided through our public health care system as it should be.
But could this be a template for where pharmacare goes? I know you have the red line that you've laid out and certainly was discussed at your convention in Hamilton earlier this year. But there are certain practicalities around cost, provincial resistance, people preferring, say, their private plan when it comes to that. And these may become obstacles that are tough for the Liberals to get over.
No, I don't see that changing with pharmacare. With pharmacare, there's too many studies, David, from the PBO to the Hoskins Advisory committee to the health committee that I sat on, 7 that I'm familiar with in a row, that found that it's only by folding pharmaceuticals into the public healthcare system that you get the 40% savings through bulk buying, that you get the cost-related non-adherence, the savings you get from people not getting sicker, the streamlined administration. So the economics are just so strong for pharmacare going through our public system that and there's frankly no evidence really to go the other way, that it would be economically and I think policy-wise foolish to do anything but to fold pharmacare through our public system. So we're going to hold firm on that.
Just one last question on dental care, just to go back there. There's been some criticism and suggestions that maybe private companies might pull back their benefits because of this, that this might be something that, well, if the state is going to do it, why should we bear that cost as an employer? And I know there's income thresholds, but maybe lower and middle incomes that get it through their employer, this could be a possibility. How confident are you that it stays? Can you put measures in place to stop that from happening?
Well, it's a realistic consideration, and it's been something that we've heard over the past couple of years. We'll have to wait and see what happens. But you have to remember that private dental plans often are different. They have cosmetic components to them. And again, as you pointed out, with the income threshold of $90,000, there are people that have coverage that wouldn't be covered by this plan. And employers, when they purchase extended healthcare plans that include dental, buy a basket of services. There's massage, there's prescriptions, there's physiotherapy and psychology. There's a whole suite of things that are covered.
It's not as easy to unwind as
That's
just
right.
pulling out one thing.
Yeah, so I honestly don't think you're going to see that happen. And if we do, then we'll have to take policy measures in the future to respond accordingly.